Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the US and around the world and give you expert insights on infectious diseases and public health. Have you ever noticed a strong, fishy smell in your genital area? If you're a woman, that smell is often a sign of bacterial vaginosis, or BV, a common vaginal infection that can be treated with antibiotics. But what if I told you that BV isn't just a women's health issue? A groundbreaking new study suggests that BV is actually a sexually transmitted infection and that male sexual partners should also be treated with antibiotics. Let's break down what this means for science, medicine, and public health. BV is the single most common reason women visit a doctor for unusual vaginal discharge. That discharge often comes with a strong, fishy odor. BV isn't caused by a single bacteria, but by a shift in the balance between good bacteria and bad bacteria. Normally, the vagina maintains an acidic environment thanks to a good bacteria, a beneficial type of bacteria called lactobacillus. But when harmful bacteria, like Gardnerella vaginalis, take over, they produce smelly compounds called amines. These same compounds are responsible for certain body odors and the smell of fish. And here's why it's worse. BV disrupts the vaginal environment, making it less acidic. And this less acidic environment amplifies the smell, especially after sex or during menstruation. Beyond being very uncomfortable, BV can have significant health consequences. Even after treatment, as many 60% of women experience a recurrence within a year. But it's not just a nuisance. BV has been linked to an increased risk of HIV, of bacterial STIs, and pregnancy complications, including preterm birth and miscarriage. The good news is that the treatment is very simple. It's a short course of oral antibiotics, usually metronidazole, or the use of a vaginal antibiotic gel. Now, for years, scientists suspected that BV might actually be also sexually transmitted, but the evidence wasn't very clear. Past studies showed that treating men for BV when their female partners had BV didn't reduce the recurrence in those female partners. But researchers in Australia tried something different this time. Instead of just giving men antibiotic pills, the same pills that they were giving to women, they also had them apply a topical antibiotic cream to the head of the penis. And the results? They're going to change how you and your sexual partners get medical care. Here's what they did in the study. They took 164 monogamous straight couples. Women diagnosed with BV were randomly assigned to one of two groups. Either their male partners received no treatment, or their male partners received oral antibiotics and a 2% clindamycin cream that they applied to the head of the penis. The outcome was so striking that the ethics committee overseeing this study stopped it early. When comparing 81 couples in which the male partner was treated to 83 couples in which the male partner was not treated at all for BV, the risk of the woman having BV come back again was 63% less. So let me emphasize that again. The risk of the woman having BV come back again was 63% less when their male partner was treated with both oral antibiotics and a topical cream that they applied to the head of their penis. So what does that mean? If you're a woman diagnosed with BV and your sexual partners have a penis, make sure they get treated also, ideally with both oral antibiotics and a topical cream. But beyond individual treatment, this study forces us to rethink how we classify BV. If treating male partners reduces recurrence, that suggests that BV is a sexually transmitted infection. And that shift carries some important scientific and societal implications. So words shape how we think about diseases. Labeling an infection as sexually transmitted often, unfortunately, carries moral judgment, fear, stigma. People with STIs are frequently seen as reckless or irresponsible, while those with other infections, like the flu or food poisoning, are not. Take cervical cancer, for example. Before we knew that cervical cancer was caused by the HPV virus, cervical cancer was seen as just an unfortunate disease of chance. But once HPV was recognized, publicly, widely available, and understood as the cause of cervical cancer, the public perception shifted, sometimes in ways that fueled stigma. We saw something similar with Mpox, formerly known as monkeypox, in 2022. The outbreak of Mpox was primarily affecting men who have sex with men, leading to debates about whether to classify Mpox as a sexually transmitted infection, an STI. Some public health officials hesitated to do that. They feared this would lead to discrimination against men who have sex with men. Others, including myself, argued that accurately labeling it as an STI was crucial for directing our public health efforts. BV may be heading down this same path. While reclassifying BV as an STI could lead to better treatment and prevention, it may also unfortunately bring unnecessary shame and silence. So, what should you do about BV? If you or your partner have BV, make sure both of you get treated. And be aware that many doctors aren't yet familiar with this new research. So if you encounter skepticism, point them to this study. At a societal level, we should embrace this advance as an opportunity to improve public health, not reinforce stigma. Sex, like eating or breathing, is a normal and essential human activity. Just as we seek to prevent infections from the food or from air we breathe, we should work to reduce infections from sex without attaching shame to it. And I hope this research leads to healthier outcomes for everyone, not just women. I'll be covering more updates on infectious diseases and public health. So if you found this video useful, please hit the like button and subscribe to Thermometer for expert insights on the biggest health challenges of our time. Thank you for watching, and I'll see you in the next one.